Okay, thank you. Well, I'm Kathy DeRue. Thank you so much for letting me join you guys today. I'm really looking forward to talking with you all about a topic that I find near and dear to my heart, sleep. So today we're going to be talking about the need for sleep. Oh, hold on, it's not, oh, there we go. Sorry, a little new to the Zoom presentation for advancing slides. So today I hope to hit on 3 really important questions. What is a good night's sleep? Why is sleep so important? And how can you get a better night's sleep? So I hope that you can walk away today with some tips on how you might be able to get a better night's sleep, maybe even starting tonight at home. Before we get started, I just had a couple questions I wanted to ask you guys to just kind of think about as we're going through the slides today. So my first question for you is, on an average night's sleep, how many hours of sleep do you think you get? Kind of just a typical average night, how many hours would you say you get? You can either just remember it, jot it down, whatever. And how do you feel when you wake up after an average night's sleep? Do you feel rested? Do you feel ready to go for the day? Or do you wish you could stay in bed and hit snooze? And then my last question for you is, in an ideal world, if you could sleep as little or as long as you would like, how many hours of sleep would you get in a perfect world so that you could feel your best? Maybe it's the same as, hopefully it's the same as your first answer, but for most people, it's probably not. There's probably going to be quite a bit of variability there. So hopefully, as we're kind of going through the slides today, I hope you kind of will keep those in the back of your head, because I'll kind of reference those later in the slideshow. So we know that as a society, we are chronically sleep deprived. We see this start even very early in childhood, unfortunately, where children are sleep deprived. And that's certainly true for adults. So the average adult in the United States gets about 6.5 hours of sleep on a weeknight. And we recommend that they get between 7 and 9 hours. And we see that that's even more true for caregivers. So parents who are caring for their children tend to get even less sleep. So this was a study done a number of years ago, and they compared parents of healthy children versus parents who are caring for kids with a number of different medical diagnoses. And as you can see from the slide, the parents of healthy children got statistically significant more sleep than the parents who are caring for children. So we know that as caregivers, you guys are at risk for poor sleep, for being sleep deprived. And so I'm really glad that we are all here today so that we can talk about ways to get a better night's sleep. In addition to not getting enough hours of sleep for many caregivers, we also know that your sleep may be poor quality. You may be more likely to report symptoms of insomnia. So there's a lot of different challenges that as caregivers, you guys can face with sleep. And one thing I want you to hopefully know is that you're not alone in struggling with sleep. Up to 86% of caregivers have reported some type of sleep disturbance. And there can be a number of reasons why that may be the case. Some of you guys may have a number of reasons that you found, but some common reasons are you may be providing care for your child in the middle of the night. Perhaps you're waking up to feed them or give them medication. Maybe you're having to attend to pain, or perhaps they're on an alarm and you have to get up and tend to the alarm. So there's a number of just logistical reasons why you may be getting up in the middle of the night to take care of your child and then finding it hard to fall back asleep once you get back to bed. We also know that just the sheer stress of caring for your child can impact your sleep. So if you have a lot weighing on your mind, you're worried about your child, that can absolutely make it harder to fall asleep when you're trying to go to bed at night. So, and I know that there's a lot more reasons why you guys may be finding sleep challenging, but those are certainly some of the more common ones that I've experienced with patients in the past. So we talked a minute ago about adults need 7 to 9 hours in most cases to get a good night's sleep. I put this slide up just so you guys can get an appreciation that really varies by age. So we know that as children, we need more sleep than we do as an adult. So you'll notice that newborns, infants, and toddlers require the most sleep. And as we age, our sleep requirements get less so that it's closer to the 7 to 9 hours as an adult. I know that you guys are parents, and so I also wanted, hopefully you guys can glean from this side based on your children's ages, what the recommended amount of sleep you guys should be aiming for your kids. So those were kind of the 2 main takeaways from this slide, is that our sleep needs change as we get older, and different recommended hours of sleep for different age groups. Now that we know how many hours of sleep we ideally should be striving for, what does a good night's sleep really look like? So many of you may be familiar with different sleep stages, but there are four main sleep stages that we think about in a good night's sleep. Stage 1, stage 2, stage 3, and then our dream sleep or REM, rapid eye movement sleep. And our body cycles through these four stages of sleep about every 90 to 120 minutes. So that for an average adult, you're getting through about 3 to 4 of these cycles in a given night. So by stage 1 is our lightest stage of sleep. It only represents about 5% or so of our sleep on an average night. And this is the lightest stage where maybe, you're aware of what's going on in the background behind you. If someone comes in and says your name, you're going to wake up fairly easily. So this is definitely our most lightest stage of sleep. And we spend about 5 to 10 minutes of this stage before we move on to stage 2. Stage 2 is still considered a light stage of sleep, but it is a little bit deeper than stage 1. So it's a little bit harder to wake up from stage 2. And as an average adult, we would spend about half the night in stage 2 sleep. Stage 3 sleep is going to be one of our deeper stages of sleep. As an adult, we spend about 10% or less on an average night in stage 3 sleep. And this is one of the biggest differences between kids and adults. So kids actually spend a lot more time in stage 3 sleep than adults do. So an average toddler or preschooler might have about a third of their night actually as stage 3 sleep. So not only as adults do we need less sleep than we do as kids, but our sleep architecture actually changes. So as an adult, we tend to have more lighter stage sleep than we do as a child, where we tend to have more of that deeper sleep. Stage 3 sleep is really important for like growth hormone release, muscle growth, tissue repair. So as a child is growing, that stage 3 sleep is really important. And then finally, we have our final deep stage of sleep, our REM sleep. And most of us are pretty familiar with this as our dream sleep. This may be where you have those vivid dreams that don't necessarily make sense sometimes. And it's really important for our learning and memory consolidation. So that's one of the critical things that happens in our dream sleep. For an average adult, we spend about a quarter of the night in our REM sleep. And as we cycle through these stages with each progressive cycle, our chunk of dream sleep actually gets larger, so that we have our largest portion of dream sleep usually in the early morning hours around like 2 or 4 a.m. So that's sort of what a typical night's sleep would look like. So now that we've kind of talked a little bit about, what does an average good night's sleep look like? What happens if you don't get a good night's sleep? What are some of the challenges of not getting a good night's sleep? I wanted to spend a few minutes talking about some of the long-term health consequences of not getting a good night's sleep, just so that we understand why sleep is so really important to our health. We know that not getting a good night's sleep puts us at increased risk of developing obesity. And we see that for a number of reasons. We think from studies, we know that if you're not getting a good night's sleep, you're more likely to eat more calories. Unfortunately, these are not good calories. They tend to be more of the junk food variety. So you may have experienced this, in the afternoon, you're kind of dragging a little bit and you want a snack and you go to the vending machine, you're more likely to get the high sugary carbohydrate snacks than you are maybe the healthier apple choice. We also know that sleep plays a role in our appetite hormones, in particular leptin and ghrelin. So we know that sleep is really critical for the signaling of when our hormones are telling our body that we're full or hungry. And then you may have also experienced this. If you're really tired, you're probably less likely to be active, right? So you're going to be less likely to go to the gym or go for a walk. So if you're not sleeping well, not only are you more likely to eat junk food, but you're also more likely to sit around on the sofa and watch TV. And so that can make it really hard, in addition to the hormone signaling. We also see that getting a poor night's sleep can increase our risk of cardiovascular disease, like high blood pressure and hypertension, and can also increase our risk for diabetes. And these are all long-term health consequences that we want to prevent as much as we possibly can. We see that poor sleep is associated with mood disorders, in particular depression and anxiety. And we do see that this works both ways. So we know that if you have depression and anxiety, it can make it a lot harder to get a good night's sleep. We also know that if you're not sleeping well, it can make it a lot harder to control your symptoms of depression and anxiety. So for people who are struggling with both mood disorders and sleep, we usually see the best results when we're treating both of them at the same time so that they can improve. And finally, this is really, I think, vitally important for everything going on in the world today. We know that sleep is really critical for our immune system to function well. And we all right now want our immune system at its best. We do see in studies that if you're chronically sleep deprived, that you're more likely at risk of getting a viral infection. In most of these studies, they were defining chronic sleep deprivation as 6 hours or less a night. So some of you may feel like you're fitting in that category based on the questions that we asked earlier. And that puts you at risk for possibly getting and most studies looking at the common cold, but certainly with everything going on in the world today, want to make sure our immune systems are functioning optimally. So in addition to the health consequences of sleep, we also know that not getting a good night's sleep can affect how you do on a daily basis. So I sort of say this is the day-to-day performance quality of life metric in terms of how sleep can impact your life. So I'm sure we've all experienced this, right? If you don't get a good night's sleep, you're going to be more sleepy during the day. You may be more likely to fall asleep at your desk, doze off for a minute, or may doze off while you're watching TV at night. That's something that we can all relate to. But a lot of people don't know some of the other daytime consequences of not getting a good night's sleep. As we mentioned earlier, we know that our dream sleep is really important for memory consolidation. So if you're not getting a good night's sleep, it's going to make it harder for you to learn. It can also increase your risk of developing dementia down the road if you are consistently getting a poor night's sleep over time. We also know that if you're not getting a good night's sleep, it can make it harder for you to focus and pay attention. In adults, we may see this as you may be more likely to make mistakes because you're not able to focus on those details. There have been studies that have shown that as adults, if we're sleep deprived, we may be more likely to make mistakes, but we may not even realize that we're making those mistakes. So that can be particularly scary when we're not even aware that we're making mistakes. For children, this may manifest more as problems with focus, concentration, and hyperactivity. So symptoms very similar to ADD and ADHD. So any child that comes in with these concerns, I always like to ask about sleep because not getting a good night's sleep can definitely exacerbate problems with focus, concentration, and hyperactivity. We spoke a minute ago about how sleep can play a role with depression and anxiety, but it can also impact your interactions with others. So if you're not getting a good night's sleep, we may have all experienced this where you probably are going to be a little bit grumpier than maybe you would be if you were more rested, right? And that can play a role in how we interact with our family members, our spouse, our coworkers. You may find yourself a little less patient. You may be more likely to be grumpy, or if someone asks you a question, to snap back at them. And so those can all have negative impacts on our relationship with others. And lastly, this one is the one that scares me the most. We know that sleep can have an impact on our reaction times. In particular, driving sleepy. We know this is just as bad as driving drunk. They've actually done studies where they sleep deprive healthy adults, put them in a simulator, and they perform just as bad behind the wheel as someone who is legally drunk. So this is something that I just tell everyone. Driving sleepy is like driving drunk. Please don't drive sleepy. Have someone else drive, take an Uber, but really want to make sure that we're safe on the roads. It only takes 1 or 2 seconds to fall asleep behind the wheel and have a tragic outcome. It can also impact your job site too, particularly if you're working with heavy machinery or equipment. It does put you in increased risk of having an accident at the job site. So a lot of reasons just from a day-to-day perspective to try to improve your sleep. So now that I've hopefully gone through a little bit about what a good night's sleep is and why sleep is important, I really wanted to spend the majority of our time this afternoon talking about ways that you can get a better night's sleep. And before we jump into all the sleep tips, I just wanted to sort of set the stage a little bit with sort of some goals that you guys can set at home. So I'm going to go through a lot of ideas today, and I don't necessarily expect for you to go home and do all of them. In fact, I don't want you to do all of them. I want you to pick 1 or 2 that you feel like you can really focus on. If you try to do all of these tonight, you're probably going to get really frustrated and not want to try again, and probably not want to ever hear my name again. So really just focus on 1 or 2, get good at doing those for the next week or so, and then build on that, add another one so that you can do it in a more manageable way, especially with everything that you guys have going on at home that you have balancing on your plate. It's not realistic to think that you're gonna be able to maintain all of these sleep tips at once. Similarly, when I asked you how many hours of sleep are you getting at night and what your ideal amount of sleep would be, if you If you answered the same for both, then I congratulate you. That's wonderful. But more than likely, there's probably a discrepancy there. So for example, if you said that your goal, that you're getting 5 to 6 hours a night, but your goal is 8, I don't expect you to go home tonight and get 8 hours of sleep. Set a manageable goal. Maybe it's a 15-minute increase in your sleep, or maybe it's 30, but do what you can do so that you can build on that, so that you can set yourself up for success. So having said that, I just wanted to turn and sort of go through some of the sleep tips. So one of the first things that I always talk about with sleep is electronics, because electronics are sleep's worst enemy. We know that if you're using a lot of electronics before bed, it can make it harder to fall asleep and stay asleep and impact your sleep quality. For that reason, I always recommend turning off your electronics at least 30 to 60 minutes before bed. And when I say electronics, just to clarify, I mean everything: the television, the phone, the iPad, the tablet, the computer, the Kindle, all of it. Unfortunately, it's all bad. The main reason is that electronics emit a lot of light. So when we're staring at the screen, our body is absorbing all of that light. And light is the biggest signal to our body that it's time to be awake. So the more light that we're exposing our body to at night, the more signals that our body is getting that it's time to be awake. And at night, we really want to be sending consistent signals that it's time to wind down, it's time for bed. So electronics really are making it harder for our body to understand that it's bedtime. And it does this because it can inhibit something that you guys are probably all familiar with: melatonin. It's available over the counter as a natural supplement, but our body actually releases it naturally as a signal that it's time for our body to go to bed. And light inhibits melatonin release. So the more electronics you're using at night, the more signals you're inhibiting from your body's own natural sleep mechanism, particularly melatonin. The other reason that I recommend that you turn off electronics is it can be stimulating. So if you're watching an exciting movie or the news, which is usually depressing, or you're answering emails, all of that's going to be mentally stimulating. And we want to try to do everything we can to help our mind wind down before bed, not rev it up before bed. So both for the light and the stimulation, I always try to recommend getting your electronics off at least 30 to 60 minutes before bed. So now that you have a little bit, maybe more time in the evenings, if we're turning the TV off, what are some of the relaxing things that you could be doing before bed to help your body wind down? So really, ideally, you would be trying to think about ways to create a healthy bedtime routine. So our bodies really like routine, and this is particularly true when it comes to sleep. So as part of a good, healthy sleep routine, we would really like to engage in a relaxing bedtime activity. Normally, this would be done ideally outside of the bedroom, or at least outside of the bed. So if you have a comfy chair or sofa or something where you can do your activity, that would be better. We really try to reserve the bed for sleep and intimate activities only. So that way our body tends to associate the bed equaling sleep. So some examples of relaxing activities might be reading a book. It might be listening to a book on tape, or music, or drawing, or coloring, playing a musical instrument, meditation, journaling. So there's a lot of different things that you can do at night to help your body unwind. Those are just some examples. I think the real trick is finding what's going to work best for you. For example, I'm an avid reader, so reading a book is actually not a good option for me because I want to read, I want to keep reading. I don't want to put it down. So sometimes, maybe reading a book you've already read, or perhaps a magazine, so you're not, trying to go to the next chapter all the time. For me, I found that coloring works really well because I was able to quiet my mind, but it's really finding what works best for you, because what works best for you may not work best for your husband or your wife or your neighbor. So it's really trying to find the best activity for you. So once you kind of wound down, hopefully by your relaxing activity outside of the bedroom, then we really want to make sure that you're keeping a consistent sleep schedule. That means both bedtime and wake time. And ideally, that would be true on weeknights and weekends. Many of you may have experienced, if you stay up a little bit later on Friday and Saturday night, and then you sleep in on the weekends, Sunday night comes and you're not tired when it's time to go to bed, right? And then Monday morning comes and you're exhausted because you didn't get to bed until late on Sunday, and you've already started the week sleep deprived. And that's not a good habit to get into. So for that reason, I recommend really trying to keep your weeknights and weekends as consistent as possible, ideally not varying by more than an hour. if you can. And that's true for our kids as well, especially, especially on the weekends. I know they really like to stay up later, but it just makes it that much harder for them to get up to go to school on Monday morning. I also recommend trying to keep your bedroom cool, and that's going to vary for everybody, but usually like 68 to 70 degrees. So we talked about light as being the biggest signal to our body that it's time to go to bed, but our body also uses body temperature as well. So our body temperature actually drops during the night while we're sleeping, and that's a signal that it's time to be asleep. And so keeping your bedroom cool can help send a consistent message to your body that it's time to go to bed. I get a lot of questions about naps. I don't know if any of you guys are nappers in the audience today, but I love a great nap. However, if you're having trouble falling asleep or staying asleep, I do generally recommend that you try to avoid taking a nap. And there's a couple of reasons why. So I liken this to my cell phone, because I think we can all relate to cell phones, right? So when your cell phone's at 5% and it's flashing at you low battery and you have to plug it in or your cell phone's gonna die. That's what I want your body battery to be when you get in bed at night. I want it to be really at its lowest because you need to recharge by sleeping. If you've taken a nap earlier in the day, you've recharged your battery a little bit so that when you get in bed, it's not going to be low. Maybe it's at 30% or 50%, whatever, but it's most likely if you've taken a nap, it's going to make it harder for you to get a good night's sleep that night. If you do take a nap, I do have a couple recommendations. One is I try to say, make it a power nap. Many of you may have heard the power nap or cat nap phrase. So what I mean by that is taking a nap that lasts no more than about 20 or 30 minutes. The reason we recommend 20 or 30 minutes is because if you recall back from the sleep stages slide that I showed you, those first two lighter stages of sleep, that's stage 1 and stage 2, that's going to be what you're going to get into if you just take a 20 or 30 minute nap. So you're going to stay in those lighter stages of sleep. When you wake up from that lighter stage of sleep, you're more likely to feel refreshed and ready to go. If you take the longer nap, say an hour, hour and a half, you're more likely to get into those deeper stages of sleep. When you wake up from those deeper stages, you're more likely to wake up sort of groggy, a little disoriented. You guys may have experienced that, like if you've taken a nap on the Saturday afternoon on the sofa and you oversleep and you wake up and you're like, where am I? That's often how you can feel when you wake up from one of those deeper stages of sleep. So that's one reason I recommend taking the power nap, is just because it helps you wake up feeling more refreshed. It also, because it's a shorter nap, it's not going to have as much of an impact on your night's sleep when you try to go to bed later that night. I also recommend that you try to take it earlier in the day. So maybe early afternoon, right after lunch. The later in the day that you take your nap, the harder it can be to fall asleep at night. It makes sense, right? If you've taken a nap at 4 or 5 o'clock and then you try to go to bed at 9, it's going to be a lot harder for you to fall asleep because you're not going to be as tired. So for that reason, I really try to avoid those later afternoon naps, especially after 4 p.m., because that's when we see it have the biggest impact on your sleep that night. I also wanted to talk a little bit about what to avoid, because I get a lot of questions about these things too. So I think most of us really enjoy caffeine. It can help as a little pick-me-up in the morning for sure. But I really try to recommend avoiding caffeine after lunch, especially if you're having trouble falling asleep or staying asleep. The reason being, caffeine has a long half-life. So if you have caffeine in the afternoon, there's a really good chance that you still have some traces of caffeine in your body when you get in bed and try to go to sleep at night. And if you're already struggling to fall asleep or stay asleep, those small amounts of caffeine can really make a difference in your sleep. I also recommend avoiding alcohol in the evenings. Most of us, I know it seems a little counterintuitive, because most of us feel like when we have a drink or two, it makes us tired. And that's true. Alcohol is a depressant. But what happens is after we fall asleep, our body starts to metabolize that alcohol. And as our body's metabolizing that alcohol, it actually creates more fragmented, poorer quality sleep, like the second half of the night. So usually you wake up after you've had more than a couple of drinks, you'll wake up feeling more tired, less rested than you would if you hadn't had anything to drink before bed. Similarly, I recommend avoiding big meals before bed, particularly if you have reflux, because this can really make it hard for you to get a good night's sleep. And I get a lot of questions about exercise. I'm a big fan of exercise. There's a lot of health benefits. We know that exercising can actually help you sleep better at night. But I do recommend trying to avoid doing it right before bedtime. Exercise generally is going to be more of a stimulant. It's going to wake us up. And it can also raise our body temperature. As you may recall, I mentioned as we sleep, our body temperature tends to dip down. So if we exercise at night and we're raising our body temperature, that's sending mixed messages to our body again that it's time to go to bed. So if you can avoid it, try to exercise earlier in the day, or at least a couple hours before bedtime to give your body a chance to unwind before you get into bed. So I know some of you may be thinking, well, those all sound great, but what do I do if I still can't sleep? Maybe I've tried these things and I'm still struggling with my sleep. So one of the things that I really recommend is if you are having trouble falling asleep, either at the beginning of the night or in the middle of the night, say you had to get up and attend to your child in the middle of the night and you get back in bed and you're wide awake. What's something that you can do to help you get back to sleep? Give yourself about 20 or 30 minutes. And if you can't fall asleep, get out of bed and do one of your relaxing activities. This can be the same thing that you did at the beginning of the night when we were talking about bedtime routine. It can be a different activity if you prefer. But the idea would be to get out of bed and go do something to sort of help quiet your mind. And there's two reasons that I recommend getting out of bed and doing the quiet activity. One is, you may recall earlier, we said we really want to reserve the bed for sleep and intimate activities only. So this is going to help reinforce again that the bed is only for sleep, that you're not watching TV, you're not, doing all these other things in bed. The other reason is, I don't know about you guys, but if I'm laying in bed and I can't fall asleep, the more I try to will myself to sleep, the harder it is sometimes to get to sleep. I don't know if you guys have ever experienced that, but simply getting out of bed and doing a relaxing activity can be a distraction. So it can help kind of quiet your mind back down. If you're having trouble, if you feel like you're sort of ruminating on certain things, doing that distracting activity can really help with that. I recommend doing that activity until you feel a little bit more sleepy, get back in bed and try to fall back asleep again. If after 20 or 30 minutes you still can't fall asleep, it's okay to get out of bed and do another relaxing activity, either the same one or a different one. So it's okay to repeat this cycle a few times if you need to try to get yourself to fall back asleep. For those of you, especially if you feel like something's on your mind, a couple of things that have really been helpful for me and some of my patients is journaling. So, if you feel like you've got a lot of things going on your mind, making journaling part of your bedtime routine or relaxing activity can really help, because just the process of getting that down on paper can really be cathartic and sort of help you. If you're a chronic to-do lister like myself, and you're thinking about what am I going to, I got to do X, Y, and Z tomorrow, take a few minutes before you go to bed and write down your to-do list for the next day. That way, if you find yourself laying in bed thinking, oh, I can't forget to do this, you can say, you know what, I already wrote that down. It's on my to-do list. It's covered. Now I can not worry about it anymore and I can go to sleep. So kind of writing things down that are on your mind can often help, whether it's journaling or the to-do list can sort of help, because you can say, you know what, I already wrote that down, and almost give permission for your mind to stop worrying about it, if that makes sense. So meditation can also be really helpful if you've got a lot on your mind, to help sort of just quiet your mind. So hopefully those are some strategies that you guys can use at home to help with sleep, with falling and staying asleep. Having said that, if you're still having trouble falling and staying asleep, I do recommend that you talk to your doctor. One of the biggest takeaways that I hope you get from today is that, one, you're not alone, that a lot of people struggle with their sleep, especially caregivers. And two, that there are resources out there to help you, and your physicians are going to be one of your biggest resources. A lot of people don't even know that sleep specialists exist. That was when I told everybody, I was a sleep specialist, most people say, I didn't even know there was such a thing. So now you know. So if you're having trouble, talk to your doctor. They may be able to help you. They may recommend that you see a sleep specialist, but just know that there are options out there to help you get a better night's sleep. Particularly if you are hearing from your partner that you're snoring, choking, gasping for air, pauses in your breathing, those would all be signs of concern for obstructive sleep apnea. And that's a medical sleep condition that we would need to evaluate and treat you for. So absolutely do talk to your doctor if you're hearing that you're doing any of those things during the night. And finally, if you're sleeping long hours, but you're never feeling rested, that's another concern, that you're probably not getting a good night's sleep. We've talked a lot about hours of sleep, getting those critical 7 to 9 hours. But in order for you to feel your best, it really is that you need to get the right amount of sleep, but you also need to get good quality of sleep. And so if one of those things isn't true, you're not going to wake up feeling well rested. So if you feel like you're getting still, the recommended hours or more and you're not rested, then that's a reason to talk to your doctor too, so we can do some evaluation to figure out why that might be happening. So in summary, thank you so much for joining us today. I hope that you have learned that sleep is really important for your health and for you to feel your best. If you don't get a good night's sleep, it can have long-term health consequences, and it can make it harder just from a day-to-day perspective as well. We talked a lot about how to get a better night's sleep and some tips that hopefully you guys can try at home. We talked about trying to aim for at least 7 to 8 hours a night, or 7 to 9 hours a night. But you don't need to necessarily do that all tonight, right? We talked about breaking that off into manageable chunks, 30 minutes at a time. Trying to avoid caffeine and alcohol, because I get a lot of questions about that. Shutting down electronics. We talked about electronics being sleep's worst enemy, and why it's so important to shut down your electronics. And then we talked about taking naps. So if you do take a nap, make it a power nap earlier in the afternoon so it doesn't impact your sleep. So with that, hopefully we've left a little bit of time for questions, because we'd love to hear if you guys have any specific questions or concerns about sleep.
I have 2 questions, Kathy.
Okay. Yes, Doug.
The first one is, it sounds like you're recommending a 2-martini lunch to avoid alcohol.
Not explicitly say that, right?
To avoid alcohol in the evening. But my other question is, I've played around a little bit with sort of length of sleep to try to, follow recommendations. And what I feel is sort of what you described after the nap, the longer nap scenario is, and I'm going to make times up, but 6 hours and 45 minutes may have me awaken, maybe feeling a little tired, but able to make it through the day and not having excessive sleepiness. But if I try to push that and sleep 7.5 hours or 7:45, then I do end up feeling like I wake up a little groggier and have struggle more. Is it that maybe I'm interrupting a full cycle and not, by trying to add that extra time on, and that is contributing, or what? I've done it several times, and it has been, when I've tried to push it a little further to get in better inside that window of recommended sleep time, I don't necessarily find myself more energized or refreshed.
Right. No, that's a great question. So, a couple, I guess it brings up a couple of different things. So, some of you guys may be familiar with like these apps on your phone that they try to wake up, they have these alarms that wake you up in your sleep cycle, right? So I think that's kind of getting a little bit at what you're talking about here, because we do see that if you wake up in those deeper stages of sleep, sometimes you can be a little bit more disoriented, groggy. You can even sort of, we call it like a sleep drunkenness kind of when you wake up and in those deeper stages of sleep. Ideally, in a perfect world, you would be waking up consistently around the same time every morning without an alarm clock, right? Because then your body is naturally coming out of those stages of sleep on its own. So if you are using an alarm clock and it's waking you up in one of those deeper stages of sleep because you're kind of artificially waking up to your alarm clock, that could absolutely be part of maybe what's going on. The other, I guess, part of that question too is I think it's important to note that everybody's different in how many hours of sleep they need, right? That's why we kind of use a range. So I think it's also important to find out how many hours of sleep do you need to feel your best. For me, it may be 8. For you, it may be 7.5. For Stephanie, it may be 7, right? And so it's really kind of zeroing in on what does it mean for you to feel your best. Because for some people, if you sleep too much, it's sort of a U-shaped curve, right? So you've got people that sleep too little and you've got people that sleep too much. And so you really want to be in the middle of that curve. And so, for you, I think it might also be kind of figuring out like, what is your perfect amount of sleep if you were to wake up without an alarm to feel your best? I don't know. Does that hopefully answer your question?
Yeah, I think it does prompt one more related question, which is that natural wake up. is there thinking that that is based on an adequate amount of sleep, or is that based on some kind of rhythm that sort of happens at a specific time, independent of when you went to sleep? Because I have found that I often do wake up before my alarm at the time, right around the time I was planning to get up, and I can get up without needing the alarm, and that happens even if I go to bed later than I had planned or get less sleep than I would have.
And when you wake up without your alarm, do you wake up feeling rested without your alarm? Yeah. So a couple of things that could be going on. I mean, our bodies do like routine. So even if if you're normally going to bed at 10 and getting up at 6, for example, right? Even if you go to bed one night at 11 or 11:30, your body is still going to be in the same routine to get up at 6, regardless of what time you went to bed, especially if that's kind of a one-off, right? I mean, if you're doing that consistently, then your body is going to sleep in to sort of make adjustments for that. But if, most of the time you're keeping a consistent sleep schedule and you stay up late, your body's still going to be on that routine of waking up at 6. So I don't know if maybe that might be a little bit about what's going on for you. But, we have a number of different signals in our body that tell us kind of when it's time to wake up, like when we're rested. So it's hard to say like what any one factor, right? Because there's a number of factors at play that might be impacting kind of at the question that you're getting at. But I think, ideally, if you're waking up just before your alarm and you're feeling well rested when you wake up, to me, that's encouraging to hear. That means that, you had a good night's sleep. And part of that may be, like I said, related to the routine that you've already set. And so, your body has some ability, if you're off on your routine every once in a while, that's not going to really impact your sleep so much, right? But if you're doing it every night or the majority of the nights, that's when you're going to start feeling more of the consequences of not getting a good night's sleep. So hopefully did that answer your question? Okay.
I would just add, sounds very similar, Doug, my situation. But I know if I do try to sleep in on the weekend a little bit longer, I feel more achy, like my body just feels, or sometimes a headache or something, where I should have just gotten up when I woke up and been done with it. And I might not necessarily fall back asleep for a long time, but I do feel, just a heavier sense, or like I say, the achy, if I try to go over that.
Absolutely. No, I hear that from a lot of people. And so often it's better, to go ahead and get out of bed when you first wake up because of that, right? Because if you stay in bed longer, you do sometimes often wake up feeling worse than if you just gotten up the first time. Yeah. So it is possible I hate to say sleep too much, right? But, you really want to be, it's like porridge, right? You want to be right in the sweet spot for your body, and that's going to be different for everybody. Keeping that consistent routine is really important. And the wake time is often what drives kind of our routine. Because if you get up early, then whenever I start working on trying to get people in the routine, I often focus on, well, what time do you wake up? And then we sort of back the bedtime up from wake up time. So, trying to keep the consistent wake time, I find is even if you have to pick one or the other, that can often that's a bigger driving factor in the sleep schedule, is the wake up time. So so I would encourage you, next time that happens on a snowy Saturday, to go ahead and get up and, you can even do your relaxing activity in your pajamas for a little while if you want, but going ahead and getting out of bed, because that's just going to help reinforce that sleep routine.
Yeah. Very good. Thank you.
So hopefully this was helpful and you guys got some ideas to try.
Yeah, I have one more question.
Sure.
So I've recently also noticed that I've been waking up about an hour 20 to an hour 30. It's within a 5 to 10 minute window consistently every morning prior to when my alarm would go off. And then I'm always in that, do I dare fall back asleep, for risk of what Deanna described of sometimes going back to sleep and then getting up. Feels worse than if you had just gotten up. But on the other hand, getting up an hour and 10 or hour and 20 minutes earlier than I'm already getting up pretty early, right, doesn't appeal to me. And so It's just been strange that when I look at the clock, it's like, wow, it's, sometimes it's within a minute or two of what it's been repetitively. Is that a signal of anything or just bad luck?
Well, it's hard to say without asking you a lot more questions
Sure.
in terms of what's going on. So, I mean, I'm happy to ask you questions offline because, they kind of get into like more like personal questions about other stuff that could be going on that might be contributing to your waking up in the middle of the night. So I'm happy to talk to you offline if you want, Doug. But, if you're waking up and you don't know why, certainly I think that would be an example maybe of why, good to talk to your doctor to sort of talk through like things that could be going on, because there are some medical reasons why you could be consistently waking up in the middle of the night that you would at least want to think about. If we think that there's really nothing going on that's prompting the wake up, then I would say my advice would be to go back to that slide where we said, if you can't fall asleep in 20 or 30 minutes, go ahead and get up. So if you wake up in the middle of the night and we think there's nothing bad going on there, then give yourself 20 or 30 minutes. And then if you still can't fall asleep, go ahead and get up. And at that point, it may be that you're up for the day. But, give yourself a little bit of time to fall asleep. But you don't really want to be laying in bed for an hour and a half staring at the ceiling and going, this is torture, right? Why can't I fall back asleep? So I would say, get up after 20 or 30 minutes. But we can talk if that's okay. We can talk maybe offline, and I'm happy to kind of ask you a bunch of questions to maybe sort out, if we think anything's going on that's causing you to wake up at the same time every night.
Thank you.
There you go.
Great. Thanks.
I have one quick question for you. So I remember my dreams a lot. Does that mean that I'm waking up in that REM cycle?
So it doesn't necessarily, but so I get that question a lot. Like, why do I remember my dreams some nights and not others? Or, oh, I never remember my dreams. Does that mean I'm not getting in my dream sleep? So I get a lot of questions kind of along those lines. We tend to think that you remember your dreams more likely if you're waking up just after a dream cycle. But the honest answer is we really don't have all the answers to that question. But that's sort of the most common thought is that, likely you're waking up shortly after the REM cycle. So you're probably in your dream sleep, and then you're probably going a little bit into a short, lighter stage of sleep and then waking up or something along those lines.
Okay. All right. I think we have about 1 minute or so left if anybody else has any other questions or comments.